Hey everyone, Dr. Shahid here, and in this video, we're going to talk about dental cements. So let's jump right in. There are 6 main categories of dental cements to focus on for the exam, each with their own unique characteristics. Let's go over them in detail, starting with zinc oxide eugenol. Zinc oxide eugenol is primarily used as a temporary cement because not only does it have a soothing effect on the pulp, but it's also easy to remove. Next, we have zinc polycarboxylate cements. These are pretty weak and there's nothing more worth mentioning about it here. Next, we have zinc phosphate cements, which used to be the most popular cement, but newer cements with better adhesive properties are now preferred in pretty much every case. One thing to note is that one component of zinc phosphate is phosphoric acid. It's even in the name. And just remember that this will irritate the pulp. Next up, we have glass ionomer cements, which are actually able to chemically bond to both enamel and dentin. But it's not really the best choice for all ceramic crowns since it doesn't have nearly the same bond strengths when compared to resin cements. They do, however, release fluoride, which is pretty cool since it'll reduce the risk of recurrent decay. And that always seemed like a cheat code to me, too good to be true almost, but the reality is that the fluoride releasing property is strongest right at the time of placement and it slowly fades with time. Alright, now let's talk about resin modified glass ionomer, which combines the fluoride releasing benefits of glass ionomer with the added strength of resin. It's a pretty durable option for many cases and you really can't go wrong with it. And finally, we have resin cements. Resin cements are the strongest cements available, making them ideal for high stress areas and restorations. They have amazing bonding capabilities to both the tooth and restorations, making it the preferred option for bonding all ceramic crowns such as lithium disilicate, lucite reinforced, zirconia, as well as for onlays where durability and strength are critical. Okay, I also want to note that from left to right, these cements decrease in solubility while increasing in bond strength. So the resin cements are not only the strongest, but the least soluble. And that makes sense because zinc oxide eugenol on the other end of the spectrum would be the most soluble. Alright, now the fun part guys. I'm going to take you through the cementation process for a typical lithium disilicate crown. So here I've removed my temporary crown and I've cleaned the tooth with pumice and I'm now ready to go ahead with the next steps. Now, there are tons of resin cement products out there, but generally they'll all comply with these set of instructions with minor modifications here and there. The important thing you need to remember is that you need to etch and bond both the restoration and the tooth. First, we'll want to prepare the restoration itself, and it all begins with etch. This is typically done for 20 seconds with 5% hydrofluoric acid, which is strong stuff, so you got to make sure you use it on the restoration, never the tooth. Next, you'll want to remove all the acid, which can be done by simply washing thoroughly with water and drying, or by placing the crown in an ultrasonic bath with some alcohol. Regardless, once the crown is etched and clean, you'll want to apply a coupling agent, typically Silane. Then you'll want to sit the crown to the side while it dries, and in the meantime, you can prepare the tooth. And just like we did for the crown, we'll want to start with etching the tooth. Except this time, it's with a much more mild etchant, good old phosphoric acid. And you can do a selective etch technique here or a total etch technique depending on your prep and how much enamel you have present. Once you've washed off the etch, you'll want to apply a bonding agent here as well. Again, just like we did with the crown. And once you've air dried the tooth to make sure there's no excess bonding agent present, you're ready for the last and most exciting step, cementation. So you grab your favorite resin cement and you load up the crown. But again guys, the Goldilocks principle is at play here. You don't want to put too much, you don't want to put too little. You want just the right amount of cement, and it's often much less than you think. And at this point, you're ready to seat the crown firmly and completely on your prepared tooth. Then you'll have to clean off the excess, floss your contacts, and light cure to lock it all in. And voila! Looks easy, but in reality guys, bonding a ceramic restoration can be one of the most nerve-wracking procedures in fixed prosthodontics, just because of the level of care that's needed in order to ensure everything goes smoothly. Now you may be asking, what about the steps for cementing other types of restorations? Well, to be honest guys, knowing how to cement a glass ceramic, which is exactly what we just did, is the most difficult one. So knowing that and the steps behind it will ensure you'll know how to tackle all the other materials as well. For zirconia restorations, the steps are essentially the same, except zirconia is really strong. Too strong even for the almighty hydrofluoric acid etch. So to create that rough microstructure on the intaglio of the crown, we actually have to blast it with aluminum oxide. And instead of using a silane coupling agent, we'll need a special coupling agent that has the MDP monomer, which is able to bond to zirconia or other metal oxides. Everything else is the same otherwise. Now notice that we have bonding and luting here. Luting just refers to a seal without any actual interactions between the materials. And you can certainly lute a zirconia crown, especially if you have an ideal preparation with nice walls. And since luting doesn't have any special chemical interactions, you really wouldn't need any of the pre-treatment steps. You can go straight to your cementation step. The same can be said for full gold and metal ceramic restorations. At the end of the day, guys, there's a ton of different products out there on the market, each with their own advantages and disadvantages. As long as you pick a reputable product that works well in your hands and you follow the manufacturer's instructions, you'll be fine. Okay, now let's quickly go over a couple complications related to cementing and restoration. If you ever find yourself in these situations I'm about to discuss, chances are you messed something up. Maybe your temp wasn't the best and attracted plaque, or maybe your finish lines were subgingival at the impression appointment, but you figured it would be fine. Regardless, the best way to deal with complications is to avoid them altogether, but alas, the first complication we'll discuss is inadequate access to your finish lines. So let's say you take off the temp and you realize there's been some gingival overgrowth, and so you can't adequately see your finish lines or seat your crown and feel the margin with your Explorer. Well, you'll have to do something about that. And the first option is to just grab a scalpel and cut the tissue away, assuming of course that we're still respecting the biological width. We can call this option surgical retraction. Or we can place retraction cords into the gingival sulcus to physically push the gums away from the tooth, allowing for better access and visibility of the finish line. Electrosurgery is always another option. And finally, we can always bust out the laser, especially when we need more precise adjustments. Alright, this next complication I wouldn't wish on my worst enemy because it essentially puts you back to square one, and it's insufficient cement. Doesn't sound so bad, but if you seat your crown and you don't get a bit of excess cement extruding from the margin, you better remove the crown ASAP and get cleaning because chances are you haven't formed a seal at the margin. If you decide to leave it as is, in no time you'll start seeing a brown discoloration at the margin. And that's because there will essentially be gaps between the crown and the tooth, and these gaps can act as entry points for plaque and bacteria, leading to issues like leakage and inflammation. Over time, this plaque built up around the gap will result in that discoloration, and that obviously doesn't just affect the aesthetics, but it's signaling the beginning of failure. That's right, you'll be a total failure as a dentist and your patients will laugh at you. Just kidding, thankfully it's just failure of the restoration, but still, not a position we want to be in, so always make sure you have a sufficient amount of cement. Remember, Goldilocks. Alright guys, let's bring it all home with some practice problems. Question number 1. Which cement is the best choice for a lucite reinforced crown? Zinc oxide eugenol, zinc phosphate, resin modified glass ionomer, or resin? And of course, the answer is resin cement. Lucite reinforced is a glass ceramic, and glass ceramics can be bonded to the tooth very predictably, which will enhance its physical properties. Question number 2. Which cement is the best choice for use in a non-retentive preparation? Zinc oxide eugenol, zinc phosphate, resin modified glass ionomer, or resin cement? And again, the answer is of course D, resin cement. In situations where we don't have built-in retention and resistance features, we'll really need a cement that can maximize the adhesive bond between the restoration and the tooth, and resin cements do that better than any other cements, bar none. Question number 3. A patient presents with a brown discoloration at the margin of a porcelain veneer 1 month after placement. What is the most likely cause? Microcracks, inadequate cement coverage, amine degradation, or silane failure? And of course, the answer is B, inadequate cement coverage. This one was a gimme question, so if you got it wrong, you gotta go back and watch the video. I got one last question for you guys. Each of the following steps are performed during the cementation of a ceramic crown except one. Which is the exception? Pause the video if you need some time, but the answer is D, phosphoric acid is used to etch the restoration. Remember guys, phosphoric acid is a weak acid. We like to use it on teeth. It's not nearly as strong as it should be to etch glass ceramics. Therefore, it's the correct answer here. And with that, we are done. As always, here's a summary of some of the high yield points we went over in this video. Thanks for watching, and see you next time.